Right. Welcome to Conceiving a Healthy Recovery, presented by Kate Daigle. My name is Danny Gillity, the Executive Director at the Eating Disorder Foundation, and I'm delighted to welcome everyone here tonight. Today's workshop is brought to you in collaboration with the Eating Disorder Foundation and Kate Daigle Counseling. The Eating Disorder Foundation was founded in 2003 with a mission to be an effective resource in the prevention and elimination of eating disorders through free and accessible education, support, and advocacy. We are a Denver-based organization that is now serving individuals and families, both nationally and internationally. You can find more information about EDF and Kate Daigle's practice in the links that I will provide in the chat. If you have questions for our presenter, I invite you to use the chat feature to communicate with me directly throughout the workshop. The chat is kept confidential and will come to me directly. We will save time for Q&A after the presentation, and I will deliver those questions to Kate. We will not be sharing the PowerPoint. However, since we are recording tonight's workshop, that will be available very soon after the presentation. And now I would like to introduce our presenter. Kate Daigle is a licensed professional counselor and a certified eating disorder specialist residing in Denver, Colorado. She has had her private practice since 2010 and has experience working with populations dealing with body image, eating disorder issues, in addition to a subspecialty of working with women also struggling with infertility and postpartum challenges. In 2019, she published her first book, The Clinical Guide to Fertility, Motherhood and Eating Disorders, and has spoken nationally as well as contributed to several other publications on the topic of eating disorders and fertility. She loves teaching her daughter the joy of gardening and spending time with her family in her downtime. You can learn more about Kate at katedaiglecounseling.com. And welcome, Kate. We're so thrilled to have you with us tonight.
Thank you so much for inviting me to present. I am excited to share my knowledge and experience with all of you. And as Danny said, if you have any questions, please put them in the chat and I will leave some time at the end of the presentation for questions and answers. So to get started, this is a topic that is near and dear to my heart. As Danny said, I've talked quite a bit about this topic, and I wanted to start just from a human personal perspective as to why I got really invested in this topic. So a little bit of my background is that I had an eating disorder from my early teens to my early 20s, about 10 years. And at that time in my life, I was not thinking about having a family. I was in school and then I was in college. I was learning and partying, just kind of doing my thing. And didn't have a thought about what it would be like 10 years down the road or fewer if I wanted to have a family. I did go through my recovery process and recovered in my early 20s. And a few years later, met my now husband, Jeff, and got married. And then a few years after that, we decided we wanted to try to have a family. By that time, I was in my early 30s and was healthy. I had been in recovery for over 7 years and was in a very healthy place in my life overall. So we started to try, and it took a while, as I am sure many people who are watching or listening may have shared experience. And first and foremost, I want you to know you're not alone if you can relate to anything that I'm going to talk about today. I got pregnant about 9 months after we started trying and was very nervous and excited, as anyone could relate to. And going into my first doctor's appointment at the 8-week mark, noticed that the heartbeat was really not up to the rate that they were hoping for. And then I started bleeding, and they called it a threatened miscarriage. I'll never forget that term. It wasn't quite a miscarriage, but it was a threatened miscarriage. And I did something I went to Google, which you should not do. I was just in a severe panic and wanted to know what a threatened miscarriage was, if there's still a chance that it could be a healthy pregnancy. And, you know, the Google doctor is not the place to go for that. But I was, you know, just really panicking. So unfortunately, we lost that pregnancy. And at that time, I hadn't known very many people who talked about having miscarriages or who talked about having had eating disorders. I was in my practice, you know, working, and so I was talking more about my experience with my eating disorder and also helping people who'd had an eating disorder. But I hadn't known a lot about the intersection between like miscarriage or infertility and eating disorders. And we were just really devastated. We wanted to start trying again as soon as I was healthy, and we did about a couple months later. And I was able to get pregnant again relatively quickly. I think it was just a few months. And that time I was more anxious than excited. Similar situation. We went into the 7-8 week appointment. I went to my same doctor, and same experience happened of a low heart rate. The baby was measuring small for where they should have been, and ultimately it was another threatened miscarriage. I still remember breaking down in the office, just like sobbing. I couldn't believe what was happening, and that this was happening again, and that I didn't know anybody who had had 2 miscarriages and an eating disorder or history. And I did. I started talking more about it. I asked friends, I asked family, have you experienced miscarriages? Like, what is this about? Like, this is when I started to go into my shame spiral about, did I do this to my body? Was there something that I did? Was my eating disorder the reason that I couldn't get pregnant and keep a healthy pregnancy? Again, there was no medical reasons that they could find for these for the miscarriages, and I came to learn that they really don't know like specifics, but up to 40% of early pregnancies or early miscarriages occur, and they don't really know, because sometimes these happen so early that women think it's their period and it could be a miscarriage. So up to 9 weeks are when these early I call them missed pregnancies happen most commonly. However, they can certainly happen through the entirety of the pregnancy. So we took a long time off. I did not want to go through that again, and wanted to prevent that if possible, but I really, really, really desperately wanted a family. So we stopped actually trying, and, you know, as you hear, like, stop trying, it'll happen naturally. It's frustrating to hear that. It's also frustrating to hear, stop stressing so much. You're gonna, that's the reason you need to stop stressing. You need to take better care of yourself. It's really hard to do that when you're grieving so much, and for something that you desperately want. So the truth that did happen for us. So I got pregnant again. I think it was about 6, maybe 9 months later, when I was almost ready to give up, though I didn't want to, but it was just so devastating to think about trying again. Luckily, that time I had a very healthy pregnancy, and I now have a 6-year-old daughter who is my world, our world. But when she was little, 6 months or so, I really wanted to learn more about the intersection of these topics. And the Eating Recovery Center was having their annual conference, and I thought, well, nothing more interesting than to do some research and see if they would like me to talk about this at their conference. And that's what happened. They were very eager to, because there's a ton of research. I think there's more and more coming out, but around the intersection of these topics. So that's where I spoke first about it, and then met my publisher there, and it kind of all just happened organically, which was very interesting. So just wanted to share that background with you all, and to get a little bit more into these definitions. So I know a lot of you know some of these definitions. I'm going to define eating disorders and infertility. But for those of you that might not be as aware of either one of those definitions, I'm just going to go through those two. So infertility is being unable to conceive after 1 year of regular unprotected sex. It can also involve recurrent pregnancy loss, such as 2 or more spontaneous miscarriages. And here's just a very general review of eating disorders. They have the second highest mortality rate behind all mental illnesses besides substance use disorders. Full recovery is possible with effective and comprehensive treatment. One of the most devastating things about eating disorders is that they affect everything. They affect your physical health, your mental health, your emotional health, your relationships. So they affect the entire system. Anorexia nervosa, restricting food, bulimia, binging and purging, binge eating disorder, binge eating. Orthorexia and pregorexia, I'm actually going to get into those more. They're not in the DSM, but they are common terms of types of eating disorders in this population. And then otherwise specified feed and eating disorder is kind of a catch-all, like for all the other ones. ARFID is one that I'm not really going to touch on today. I can't get into everything in details, but those are just kind of some of the more general basic eating disorders that can affect people and also their reproductive health. So when I was doing my research, I found that almost twice as many women with a current eating disorder seek out fertility treatment than women who have not had an eating disorder. So with women who identified as having eating disorders, I think it was about 22% had sought out fertility treatment. And then in the general population, I believe it was about half that, like 13, 14%. So that was something interesting. I thought, like, wow, how does an eating disorder affect fertility? I also want to say as many as 75 to 80% of women will go on to conceive and have a successful pregnancy after being treated for their eating disorder. And that women in full recovery have the same chance of getting pregnant as women who've never had an eating disorder. There, of course, can be other medical issues that are not related to the eating disorder that can affect the pregnancy and fertility. But as far as eating disorders and recovery goes, someone who is in full recovery is as healthy as someone who has never had one. So when I was researching my book, I had 2 focus populations. So women in sustained eating disorder recovery, 3 or more years, who experience fertility issues. And then women with an active eating disorder or disordered eating who get pregnant either intentionally or unintentionally. And I wanted to explore the experience of shame in both of these populations. And then I'm just going to go through these populations through kind of this journey of conception and then pregnancy and then postpartum and parenthood. So in conception, here's some of the medical complications that can arise from having an active eating disorder. Amenorrhea, the absence of menses, which you may be familiar with. It affects ovulation and affects a woman's body being healthy enough to ovulate and to conceive and carry a baby. Of women with anorexia-like symptoms, up to 90% reported a disruption of their menses for at least 3 months. So while anorexia is not the only type of eating disorder that can affect their menses, it seemed in the research that it was the one with the highest report of disruption. After significant chronic weight loss, as is with anorexia, reproductive organs regress back to pre-pubescent state. So basically, there aren't enough resources caloric-wise to sustain the human life, let alone a fetus. So the body perceives that as famine and threat and goes into protective state. And the brain and the body both perceive that. And I read, what was interesting is this happens in both men and women with chronic weight loss, is that the brain kind of feels like they're back to a teenage adolescent place because they can't sustain anymore. So that definitely affects hormone production for women and for men. I interviewed Dr. Gaudiani, who many of you might be familiar with. She's an eating disorder specialist physician and has worked with many people with these types of issues. One of the most interesting things that I discovered was, even with the high rate of menses disruption, women with anorexia are still becoming pregnant. And Dr. G said, well, eggs still happen. And it's true. One of the studies I'm going to go into was around women with anorexia who spontaneously and unintentionally became pregnant, and then what that was like for them. Additional medical concerns for conception is poor nutrition, dehydration. With bulimia, there can be hormone imbalance due to binging and purging, or restriction can affect hormones as well. Our organs need body fat to function, all of our organs, including and especially our reproductive organs. So going back to the famine mindset, if there's not enough body fat to sustain a pregnancy, the body just can't and will not give the signals that it can conceive. Cardiac irregularities and poor bone density are also medical effects from eating disorders that can affect fertility. And then we go to the emotional challenges of, if you are trying to conceive and have had an eating disorder or currently do have an eating disorder, the grief that many people, if you can relate to, I definitely did, of will it be this month? And it's such a long waiting period. It's so long to figure out what's going on with your body. And then if you get a negative pregnancy test, it's a whole nother month of not knowing and trying. And then that can lead to anxiety, waiting impatience, feeling like you don't have control of your body anymore, or of the eating disorder. And we'll talk more about that, but choosing between your recovery and having a family and your eating disorder can be an incredible internal battle. And as with eating disorders and fertility issues, there's a lot of internalization of shame, guilt, fear, all of those lovely human experiences that are hard to talk about and hard to even put into words sometimes. And I definitely experienced a lot of that. It affects relationships with your partner, one's partner, projection, just even with one's family, friends. I had a hard time with family and friends who were pregnant when I was going through my struggles. And even people I didn't know. I had anger. I projected anger onto people I didn't even know that were pregnant. And those people couldn't, it's not their fault. They couldn't hide their pregnancy. It's like they, it's wonderful for them. But for people who are struggling with infertility, it's very difficult. So lots of isolation. And then financial stress. If we were lucky enough that we didn't have to go through fertility treatments, but I know millions and millions of people do and have to spend thousands and thousands and thousands of dollars. So that's another stress on this process. And then PCOS, I'm not going to go too much into it. It's an endocrine disorder that can affect reproduction. And it's highly undiagnosed. So almost 70% of women who have it are undiagnosed. I looked into the connection between PCOS and eating disorders. And again, this is another area for more research. There wasn't a direct link, except for that having a PCOS diagnosis can definitely result in stress and more difficulty in getting pregnant because of the what the syndrome itself can do to the reproductive system, and can trigger eating disorder symptoms as a coping mechanism, whether that's binging and purging, or if a doctor who is not well versed in eating disorders recommends weight loss for PCOS, that can certainly trigger someone to go into eating disorder symptoms. And so then women with PCOS are over 3 times more likely to have an eating disorder diagnosis. It's very complex kind of how these all connect, but it's something that needs more research, and again can lead to more shame and feeling like loss of control. One study that I found did look between PCOS and binge eating, and that there's some metabolic symptoms that can trigger binge purge behavior. The hormones are disrupted. Altered insulin levels can lead to like dieting cycle. Like I said, the doctor might say, well, start by losing weight, and then maybe that'll help your fertility. And with the doctor not knowing someone's history and recommending that can be, or not being sensitive to their history, that can be incredibly challenging and difficult. And then the psychological effects. PCOS is associated with high levels of body dysfunction, increased prevalence of mood and anxiety disorders, and those are very commonly associated with eating disordered eating. So just want to kind of put that out there for more for more research. And we definitely need to screen for eating disorders, or doctors do, before recommending weight loss. And it is shown that lifestyle modification, not just a weight loss focus, is actually the most effective way of treating PCOS. So here's one of the studies I was going to go into of women with anorexia. 40% reported, this is I can't remember how many, in the hundreds of participants, 40% reported an unintended pregnancy. And these findings may result from false beliefs about their ability to get pregnant, and therefore lack of contraceptive use. It's also often a trait of people with eating disorders to engage in risky behavior. And so that might be a lack of contraceptive use, believing that they can't get pregnant. And this is where doctors, again, should need to be educated to come in and educate patients about that they can still get pregnant. So negative attitudes towards pregnancy were more common among women with eating disorders than in the general population. And patients with anorexia who are really in their eating disorder more frequently viewed motherhood as a personal sacrifice and cited fear of losing their anorexic identity. Again, going back to the values, like what matters more. You find out you're pregnant, you didn't intend to be pregnant. What do you do? How do you battle that eating disorder part that doesn't want your body to change, doesn't want anything to change, just wants everything to be rigid? That's a really difficult place to be in. A more positive note is other women with anorexia tended to create a new connection with their bodies while pregnant by replacing the old goal of thinness with the new goal of having a healthy fetus. The identity shift of the old anorexic self to the new pregnant self may aid in the remission of anorexic behaviors, at least temporarily while pregnant. So for anyone who's working with pregnant women with eating disorders, and it is very common that they shift to the new pregnant self and wanting to have a healthy fetus, this is a great time for intervention with eating disorder behaviors to help the women really hone in on their values of what matters more than the eating disorder. This is all like the same study that is in my notes that I can share with you if you're interested, but I just thought it was really interesting. Rates of intentional pregnancy were 58% in women with anorexia and 72% in the general population. So I guess that's kind of the same, like women who wanted to get pregnant without eating disorders did so more intentionally than women with anorexia. But that those who did get pregnant unintentionally came with fear of weight gain, losing control, identity challenges, etc. Not super surprisingly, bulimia can cause birth defects and premature birth. I read smaller births, same with or smaller babies. I mean, same with anorexia. There needs to be more research on binge eating disorder with eating disorders. But I did read that they had a higher rate of miscarriage than the general population, up to 50%. Again, more research needs to be done. So many women show up to infertility clinics, going back to the first slide about the higher rates of seeking fertility treatment in eating disorder populations. They show up because they can't get pregnant with diagnosed or undiagnosed or undisclosed eating disorders. So whether the women know that they have that they're conscious of it, or if they're just in denial of it, they don't necessarily disclose that. So there's stigma around it, fear of losing their eating disorder. Only 1/3 of women who've had an eating disorder report this to their OB. And again, ask yourself, why might that be? Some of these same things, stigma, shame, losing their eating disorder. And doctors don't feel super comfortable in general asking if a woman has an eating disorder past. And I'll get into that a little bit later, because they don't always feel confident with their knowledge of what to ask, how to ask these questions. Challenges during pregnancy. So proper nutrition, these are for women with or without an eating disorder. Proper nutrition is very important. An interesting statistic is up to 70% of eating disorder patients will experience remission during pregnancy. And that goes back to connecting maybe to their new pregnant self, wanting to nurture the fetus, healthy identity, and falsely believing that they're in remission during this time, which is, again, a good time for intervention to really work with them on their recovery, but it's also can be some false beliefs that they're cured. And then they up to 75% will relapse by 18 months postpartum. And this is a lot of factors: stress, identity changes, role shifts, sleep, not getting sleep. There's so many reasons that relapse is more likely or can happen, up to 75%. Body image changes. Your eating disorder identity can shift during your pregnancy. Like I said, there's a higher likelihood of premature births, low birth weight, labor complications, difficulty bonding with nursing or not nursing. Any fed is best, whether you're nursing or not. But if a woman is active in her eating disorder and wants to nurse, it's a little bit more difficult to bond. If she's active in her eating disorder, she's also not producing the milk that she needs to most of the time. There's a higher rate of induced abortions in women with anorexia, which might not be surprising based on kind of the information I was just sharing about the rate of unintended pregnancies. Pregorexia is that term that is not a clinical term, but more talks about anorexia during pregnancy. So like clean eating, healthy eating, like that kind of stuff, diet stuff that is like supposed to be good for you, but in pregnancy you need to eat as much as your body is asking and what it needs. And so pregorexia is one of the morphs, you could say, of anorexia that can severely hurt the baby and the mom. I don't think I'm gonna have enough time to go through all of this, but I will share, or I'll keep this here if you want to read. It's about how women with eating disorders might have different outcomes in their newborns based on their eating disorder. So like there's genetic factors and there's environmental factors too. how the health of the baby when they are born. Basically, you can kind of read through that. I wanted to talk about mood disorders. So in one of the studies of pregnant women, 1.5% had active eating disorders, and 16% had experienced an eating disorder in some point of their life. And the women who had experienced an eating disorder were more likely to have current depression, anxiety, compared to women who had not had an eating disorder. And women with active eating disorders while pregnant were more likely to have current anxiety, borderline personality disorder, compared to women without eating disorders. Any woman who has a baby or is pregnant needs extra support during this journey. There's a higher likelihood of postpartum depression or anxiety happening if there were prenatal conditions of that already occurring. This is an interesting concept I've kind of already touched on, but a new eating disorder during pregnancy. So as you might know, an eating disorder is very persistent and may shift during pregnancy. So from binge purge type to solely binging, or from anorexia to binging and purging. These can kind of shift to a different new identity. So it's something to pay attention to during pregnancy as well. There's often a tug of war between meeting the needs of the eating disorder and meeting the needs of the unborn child. I just really feel for women who are in that tug of war and trying to figure out what to do. There's a lot of demand. Like I said, sometimes they return to the old eating disorder postpartum. And I mentioned this too, this is the time during pregnancy when, especially if a woman is really working on bonding with her fetus, to do some attachment work to really help them connect with their bodies, with their babies, to nurture their bodies so that their babies can be healthy and that they can be healthy in long-term recovery. This is kind of a personal rant of mine. I really hate the word miscarriage. It's an ancient term that blames the victim, blames the woman that she did something wrong. She miscarried. She did something to contribute to the loss, and it's an awful experience. I know many people now that I've been talking more about it, gone through it. It's almost an invisibilized loss, because you might not have shared with people that you're pregnant, and then it's just devastating. And then it can lead to shame. Did I do this to my baby? You can kind of read through this. I think I've talked through a lot of this. So I prefer the term pregnancy loss to miscarriage, and I really hope we can change some of that verbiage, starting with doctors. The threatened miscarriage is just like one of the stupidest terms I've ever heard. So then we're going to move into postpartum attachment and eating disorder challenges. So again, any parent knows just how difficult that is, no matter who you are, if you've had an eating disorder or not. It can be more difficult for women with an active eating disorder to bond with their baby in or out of the womb, and that can come with elevated risks of postpartum depression or anxiety. One study I read was around a mom with active bulimia, and she was over restrictive with her child in terms of what the child ate, but not just that, in terms of what the child did, what sleep training, all of these really hard things that any parent needs to do. But she was over concerned and over involved in trying to control the child's development, which is really sad for her child. And again, I want to remind everyone that full recovery is possible, and that you can have a healthy relationship with your child in secure attachment in recovery. I'm really into attachment. It's one of my favorite topics. So I think it's just really, it really says a lot about who we are and how we relate to people. So dismissive avoidant attachment was the most common type among teens who developed an eating disorder or children. And this was said to come because unreliable caretakers, so maybe a mom who had bulimia or an eating disorder, and wasn't able to be there for their child, left the child feeling with a deep sense of fear of intimacy, maybe a feeling of abandonment, or that close attachments are not needed or threatening as a protection. Anxious preoccupied was the most common attachment style among new mothers with an active eating disorder. Again, as I mentioned with the mom who had bulimia, she was just very, very preoccupied with everything going a certain way. And attachment brings us all back to our primary relationships and wounds. So identity issues due to the eating disorder, not knowing who you are or what identity you really want to focus on, can cause new moms to be desperate to form a bond with their child. They're frequently looking to their primary attachment. So was their partner now their child to rescue or complete them, and may feel a deep emotional hunger due to this. It's really interesting stuff, just how we try to be whole people in different parts of our different roles in our lives and different seasons in our life. And in my book, I do go through quite a few tools and mindfulness exercises to help new and pregnant moms bond with their babies and themselves. And this is some of the stuff I kind of already went through. Nursing can be really difficult in postpartum. If there's an active eating disorder, bonding in general can be pretty difficult. And then body image dissatisfaction has been associated with reduced breastfeeding intention and duration. And again, just more changes adjusting to a brand new family system, postpartum, anxiety, depression, relapse, partners that need, that they need help, they need attention too, and kind of nurturing that partnership is really hard to do in those first year or so. There's more research that needs to be done in groups that are not anorexia. That's my takeaway from a lot of the research that I've done. And then collaboration of care between doctors and nutritionist therapists, like Health at Every Size, which I hope all of you are aware of, is the only way to treat anyone, but especially a woman coming to you with wanting to get pregnant and not wanting to be shamed or told to go on a diet. As I said, up to one third of patients don't disclose that they have had an eating disorder history out of shame or fear of judgment, or fear maybe the eating disorder would be taken away. And that up to 2/3 in a major study reported no assessment for the eating disorder at their OB appointment. MDs have said they don't feel super confident and have only had basically one course in medical school on eating disorders, which I believe really needs to change as well. Dr. Ganiani said, "I'm continually astounded by the damaging power of physician internalized size stigma." So just a lot of assumptions and judgments on people based on their weight and not their health status. I'm probably going to go through some of this. It's pretty much similar to what I said, that factors to getting help are current, maybe a person not wanting to recover and not believing that they're sick enough, basically. Stigma. Physicians said that they believe that they don't have enough training, that their role should be more advisory and supportive than intervening. They might have their own beliefs and values, biases about eating disorders, and stigma and taboo, discomfort in bringing up the topic. This is how physicians reported their difficulty with assessing for eating disorders in the study that I wrote. Again, Health at Every Size is the most ethical way to treat eating disorders and fertility issues. There's just kind of the basics on Health at Every Size. I really wanted to go through my case study really quick before we wrap up and give time for questions. So this was one of my clients years ago. her real name is not Amanda, and she gave consent for me to talk about this case. At the time that I saw her, she was in her late 20s. She had a history of severe alcohol abuse disorder and bulimia. She had 2 DUIs. She had had irregular periods since her mid-teens due to her eating disorder. She was having unprotected sex. She didn't think she could get pregnant with her irregular periods. She discovered she was pregnant at 23 and a half weeks, where she thought she was just really bloated, and was drinking during this time, and running 6 to 8 miles a day. Her boyfriend and her had a rocky relationship. Her boyfriend had some religious concerns that he didn't feel comfortable sharing this with his family. She searched for a doctor who would perform a late-term abortion. Could not find one, or I don't know if that was the case necessarily, or that she chose not to do that. She did have good family support, and she decides to continue with her pregnancy and pursue adoption. She did immediately stop drinking and did her best to end her eating disorder behaviors during her pregnancy. And really, she did a really good job at that. She was one of the people I saw really hone in on wanting to have a healthy baby and do whatever she could. She did have so much shame and fear along with all of that. For her adoption, she chose a couple who had their own infertility struggles to be the parents. She gives birth to a healthy baby girl, and she felt the intense internal struggle to keep the baby or not, as I am sure many parents, birth parents struggle with, and also must be really difficult for adoptive parents. She did ultimately decide to keep the baby. She felt her role as mom was more important than her addiction and eating disorder. She had a relapse at 6 months, but is doing well now, and her daughter is thriving and very happy and healthy. My co-experience I just wanted to share briefly was that this was right during the time where I was struggling with my miscarriages and was having a really hard time. I had supervision and everything and was professional. She didn't know anything about what I was going through, but internally it was very difficult to work with her, as she was one of those people who spontaneously got pregnant and didn't know if she could care for the baby. And I was going through my own struggle of desperately wanting a child and wasn't able to have one yet. So many of us go through these kind of co-experiences with our clients, and I think it can be incredibly therapeutic. She's graduated from my care, and I kind of shared later on what was going on, and that I was pregnant when I was pregnant, and she was very happy for me. It was a beautiful end to that story, but this is what she said: becoming pregnant, deciding to keep my daughter changed the way I took care of myself. I finally stopped judging myself and beating myself up, and really started appreciating how amazing my body was. Despite putting it through so much stress and turmoil, I was growing a little person. I spent many nights in silence, laying on my bed and watching my big pregnant belly move while she kicked me. It's hard to even write this now because I cannot imagine life without her. This is just kind of what this is how I worked with her, kind of working with her values, her support system, trying to reduce her shame and have a plan for how she was going to deal postpartum. And then Brene Brown, we all know her. I just wanted to bring the last part here of shame. That can be a common thread of all of these experiences I've talked about today. And I certainly had some of these. It's my fault. I caused this by my eating disorder. I'm terrified of gaining weight. I know that's a common experience for many women wanting to get pregnant. Am I strong enough to be a mother? What if I don't want to give up my eating disorder? That's a big shame point. Am I worthy enough to be a mother? I don't know if I want this child. There's something wrong with me because I'm fat. I can't conceive. My body is broken. I am broken. Probably many, many, many more thoughts and fears that have come up for women and partners, going through it together. And then trying to work with the shame of deconstructing expectations on women, what they should and shouldn't be, what they should and shouldn't look like. Talking about the shame, helping to define values. That is, again, in ACT, we talk about that a lot. Like, that's the driving force to get through some of these difficult experiences, is what matters more. And to try to connect with others. So for my book, I interviewed over 30 people, and it started with just me putting it out there to my network. Like, anybody have this experience? I'm writing a book about it. I don't know. I went through it, and I got hordes and hordes of people coming with their stories. And it was amazing just to share some of that in my book, and just kind of, it helped me for sure feel like I wasn't alone. And I know that it's helped a lot of them feel like they're not alone too. So it's such a cool thing. And again, with miscarriages, or for me, it was miscarriages, but infertility and with eating disorders, they both thrive in secrecy and shame. So if we can talk more about it, it helps us all come together more. That's my daughter, Natalie. She is my heart, and she just turned 6. And this is my book. If you are interested, you can reach out to me. I have some copies I can send you at a discounted rate from the publisher. So you have my contact info here. And I think I did pretty good to leave about 10 minutes for questions.
Sorry, I was on mute. Thank you so much, Kate. Your timing was perfect. We got one question really hitting on what you were talking about at the end around shame, around the fear of gaining a lot of weight during pregnancy, and then having that reinforced by the doctors who say that you're gaining too much weight. And then related to this question of just like losing joy around being pregnant because of those fears. And so how can we work with that fear, this person specifically asked, of the gaining weight question, and tapping more into finding the joy in being pregnant?
That's such a difficult struggle, I feel like, because that's what the eating disorder latches onto, as it's like purpose, you could say, of like keeping your body a certain way. And yet naturally, that's what our bodies want to do and need to do, is to gain weight during pregnancy again, so our organs are healthy, our baby's healthy. And yes, doctors often say, okay, you're good, you don't need to gain anymore, or I want you to gain this much. Or I even had someone tell me that they worked really hard to lose like all of their baby weight before their 6-week postpartum appointment, and that their doctor just was like, oh, that's amazing, you did so great, I'm so wow. And it was not in a healthy way. So how do we work with that? I think that if we can ask our doctors to not talk about weight. I think that's in general all around with eating disorders and doctors, is why do we have to talk about that? That's not the most important thing. And that's, so you asked about kind of reconnecting with joy. That comes, for me, it was about feeling my body growing because my daughter was growing. And like, that was a beautiful experience to feel her inside of me. Now, I know pregnancy is not amazing for many people, and there's a lot of like not great side effects, but just kind of remembering the purpose of why your body is changing, and that is your ultimate joy. And again, that doctors don't know necessarily what to say or how to say it. So try to not take everything take it with a grain of salt, the way that they talk.
Yeah, no, that's a really good advice. And also, so some follow-up questions to that are, the initial conversation with the doctor, of just even telling them that you're struggling, and any recommendations on how to even start that. And also this idea of like getting weight every time we go to the doctor, and do we have permission to ask not to get weighed, and what that might look like?
That's a good question about being pregnant and getting weighed. I asked Dr. G that question, and she doesn't weigh her patients unless it is medically necessary. And so I believe that if we could ask the doctor to say if we're in a healthy range for like so the baby should be growing a certain rate every time you see the doctor, and that doesn't have to do with your weight as much as the measuring of the baby, as they do their measurements. So in my eyes, that doesn't have anything to do with your weight. Of course, they want to, they can see how heavy the baby is through their measurement. So I would think it's totally okay to ask to not be weighed, but again, I'm not a doctor, so I don't know exactly what that need is with the pregnancy part.
And I think it's important that even if they do weigh us, like that you can say, I don't want to know my weight.
Exactly. If there's a reason. And pregnancy is most likely one of the medical necessity times for being weighed. It could be, but you don't need to know that necessarily.
Yeah, for sure.
And how to broach the subject. That's a hard one because it really is on the patient, it seems to be, and that's not really fair because there's already a big power imbalance between patient and client. And so for the client this is why I think only up to a third bring it up, is because they're already in like disempowered spot. And so to find a doctor that you feel really safe with and broach the subject of, see how that goes, but it's hard.
Yeah. Oh, for sure. And then some questions and thoughts around research or conversations that are being had about how infertility issues and these conversations around conceiving are present within the trans and queer communities, and if research is being done, or your thoughts on that, even requesting a follow-up presentation potentially about that, but just wanted to leave the last few minutes.
No, that's a very, very good point and question. And I wish I had more time to go into all of that. And I mean, even in my own research, I haven't I didn't find a lot about that, but that is something that I'm really interested to learn more about myself, and to kind of destigmatize that for people in all the populations of, your body is amazing the way it was made, and however you show up, you deserve to be treated, with respect in the medical community, as well as, have a healthy pregnancy. So that is something that I want to do more research on, and maybe I can come back with another presentation.
That would be amazing.
Okay. I really don't know that there's a lot of research, but I will look. I definitely am interested in it. So.
Okay. Thank you for that. And lastly, so I'm just going to read this last question that we got. So someone says, I sometimes struggle to stay connected to wanting pregnancy as a driver for recovery because it seems so far in the future, while the ED is here today and now. Any advice for staying connected to wanting pregnancy, a family down the road to help your recovery in the now?
Man, I feel you. When I chose my recovery, like really got to my, I guess, value around that. It was to have a career and a family. And I didn't believe I could do that without an eating disorder, but I was young too. And I think for me, it was less about being pregnant at that time than like relationships. And so if you think of what relationships you have now that maybe the eating disorder is interfering with, could be a partner, could be a loved one, that you don't feel like you can be your true self, you can't feel as connected and intimate with that person, that's going to get in the way too of a future, like that's going to carry with you through your life and wanting to have a family someday. The eating disorder most likely will get in the way of that too. Just the intimate connection, the attachment piece. And so maybe you're not ready for pregnancy right now, but if you can look at the interpersonal disruptions that the eating disorder causes right now, and then what values you have right now, you can continue fighting. It's just a day-to-day fight in recovery, every single day. Why? What matters?
Yeah. just remembering, I think it's a good message to end on, of just like staying connected to our values and what we have in our life that are positive and mean the most as we move through recovery.
Yeah, recovery is hard. And then trying to, have a healthy pregnancy and family, it's very difficult. But I do want to end on, it's possible, and full recovery is possible. And Dr. G, she reiterated that being fully recovered, you are just as healthy to have a family as anyone else who hasn't had an eating disorder. So there's still hope out there. And I know a lot of people who have been through it and, gotten past that. So don't ever stop fighting.
Thank you so much for that message. And again, thank you all for being here tonight. You have EDF's contact information as well as Kate's. Please reach out to us if you have any follow-up questions or any lingering thoughts or concerns that you want to keep dialoguing about. But yes, thank you all for being here. Thank you, Kate, for presenting, for sharing your story with us. We're really grateful for your time. And yeah, be in touch if anyone needs anything else. Thank you so much.
Thank you all. Thank you.